Over 80% of children diagnosed with cancer now survive. The medical progress is extraordinary, that's worth celebrating. But what we don't really hear much about is the hidden crisis that continues beyond survival. When people hear a child survived cancer, they think, great, they're okay now. But survival is just the beginning. It's the start of a lifelong journey. Modern treatment is incredibly good at getting rid of the cancer, but it often comes with a price that survivors have to face for the rest of their lifetime. We're talking about heart problems, secondary cancers, infertility, memory issues, depression, and anxiety. All things their bodies have to manage because of the medicine that saved their lives. 79% of survivors experience at least one late effects more than 15 years after diagnosis. And here's the critical part. Survivorship isn't just about the survivor. It's about enabling the very best possible life for the child and their family. A childhood cancer diagnosis impacts everyone in the family. The parents, siblings, extended family members, the entire family unit is affected emotionally, financially, and socially. Parents often have to leave their jobs to provide care, and the financial loss continues to affect the family's finances for years. Siblings experience less parental tension, emotional distress, and isolation. About a quarter of healthy siblings meet criteria for post-traumatic stress disorder. However, 71% of parents report their children receive no formal supportive services. Parents themselves carry ongoing stress and anxiety for years after the child finishes treatment, and there's a constant worry about late effects, about recurrence. The uncertainty affects the whole family. Survivorship is a core thing for Children's Cancer CoLab, and we're committed to listen, reflect, and learn from lived experience, because we know that people who know most about survivorships are the survivors and the families themselves. They reveal gaps our systems can't see from the outside. They are the true experts in their own journey, and their perspective highlights what truly matters for living well in survivorship. So we initiated this consultation to ground our survivorship research investment in lived experience. We want to ensure that when we allocate funding and prioritize research, they translate into meaningful improvements for survivors and families. We took a stepwise approach. First, we conducted one-on-one semi-structured interviews with survivors and families to hear their stories and understand their personal experiences, challenges, and unmet needs. We also worked with our patient and family advisory committee. These regular meetings helped us identify common themes, validate findings from individual interviews, and shape the agenda for our roundtable discussion. Lastly, we brought everyone together. The survivors, their families, the researchers and clinicians in survivorship, as well as representatives from childhood cancer charities, to have an open conversation about what needs to change. We organized a roundtable discussion around 5 key themes: psychological well-being, medical and health needs, social reintegration, educational and vocational challenges, and financial strain. Overall, we captured 207 discrete insights. Of these, 129 related to specific challenges families face, and 78 describe what good survivorship could look like. When we broke this down by survivorship stages, 52 insights related to the acute treatment phase, 33 to the end of treatment transition, 75 to long-term follow-up and late effect, and 46 to ongoing survivorship experiences. When we analyzed the insights, there were 5 clear themes which align well with what other studies have reported. But what really stood out for us was that the psychosocial burden doesn't just affect the survivor, it hits the entire family. However, support services for families aren't always available beyond a certain point, especially when it comes to support for siblings and parents. We also hear this phrase a lot. Survivors talk about falling off the cliff when they leave tertiary care. The system becomes fragmented as they transition into adult setting, and young people have to become experts in their own medical needs while trying to navigate a system that's incredibly complex. Sometimes the healthcare professionals themselves haven't had the training to support what they need. It's even worse if you're living in a regional or rural area where you're dealing with all the fragmentation plus limited access to clinicians who haven't had much experience with childhood cancer survivors. Schools often don't know about the late effects and how it impacts learning, so they aren't as well set up to provide the support survivors need for things like cognitive challenges. Support exists, but it's fragmented and inconsistent. Services that should be working together aren't talking to each other, and families are left to fill the gaps, coordinating care, chasing answers, and advocating for themselves when they should be able to rely on an integrated system. These insights are extremely valuable and will directly inform how we prioritize research and innovation in survivorship care and support. We're committed to comprehensive family-centered approaches that recognize survivorship is a lifelong journey. We're prioritizing seamless transitions between care phases and coordinating support across systems. We would like to explore other support services that can ease the financial strain for families and ways to improve psychosocial outcomes. If you'd like to learn more about the specific insights, opportunities, and quotes from the consultation, the full report is available on our website. Lastly, thank you for listening, and thank you to the survivors and families who trusted us with their stories.